The following is a presentation of the Healthcare Facilities Network. Hello, and welcome to the Healthcare Facilities Network. I'm your host, Peter Martin of Gossel Martin Associates. As always, thank you for clicking on this video. Today, we are releasing the fourth episode of Career Ladders. So Career Ladders episode 4. If you have not seen a Career Ladders episode in the past or before, we take resumes that are in our resume database of candidates who remain nameless and faceless with all identifying information removed, and we look at their career paths to see how they got where they got in the world of healthcare facilities management. So today, we're going to look at 10 resumes. 5 of them will be from the planning, design, and construction side because we haven't looked at that career path yet. And the other 5 will be from the compliance side because we've yet to look at that career path. If you've episode 3, we looked at engineering career paths as well as critical access hospitals. It's early in the morning, so critical was a tough word. Critical access hospitals. So that was episode 3, engineers, critical access hospitals, facility directors. Episode 2, we looked at a potpourri of, I don't say that word a lot, potpourri. We looked at a potpourri of different professionals who came from, we had some police officers, firefighters, military, some of the non-traditional paths where they had a career prior to coming into healthcare facilities management. And then the first episode was just kind of completely random. Never really thought we would do multiple episodes of these. So the first one, I just took 10 resumes of people and we looked at them. So this is episode 4, career paths. As I said, we will look at planning, design, construction, and compliance. First, before I share my screen, I don't know if you saw, we're recording this in early March. Back in late January, Gallup came out with a article about an employee survey, and they do it every year. One of the numbers I thought was interesting, for the year 2023, they found that only 33% of employees were engaged in their role. That was up 1% from 32% of employees who were engaged in 2022. So one way to look at that, 33% were engaged. Well, that means 67% were not engaged. Seems like a high number. And some of the reasons for that was people said they don't know what is expected of them. The role, the clarity around the role, and just the lack of communication going back and forth. So again, not really anything new, but kind of a continuation. We've said a number of times, as the world and as healthcare facility management becomes more chaotic, it's more important than ever to have role clarity, as it's what employees are wanting. We do a class on level setting, which I think is critically important, even more so now than ever. In short, level setting makes sure that you and the person to whom you report are on the same page. It's not a performance appraisal discussion. It's just a check-in to make sure that you are aligned with the person you report to. So if you want to check that out, it was a Gallup survey. It was released in January of 2024. 67% of folks not engaged. So with that, let me share my screen. Thought looking at career ladders and resumes, well, an employee engagement survey would be appropriate. Let me go full screen here. Okay, so this PDC career path number 1. I used green for architects. So a little color coding. I don't know if you can catch it, but the bright green, as you can see, this person started in urban planning and actually has quite a few. So we start at the bottom. All of these start at the bottom. We look at their education and then their career path. So we start here at the bottom and then we rise up. And you can see, and it's interesting, this person bounced around quite a bit, and you can see didn't start in healthcare. Healthcare is noted by these darker greens. So these are the darker greens. So they start in, your typical PDC, architectural firm, urban planning, and then they make that transition, from owner's rep. We see that a lot, especially in, the PDC career path, planning, design, construction career path is an interesting one, because architects make it into FM in a number of different ways. And, for many, it's not really a career that they had thought of. This person, as you can see, they rose all the way up to a system VP of construction and real estate with a large system. At one point, they also had FM. You can see down here. So a lot of moving around with this person's career path, and that's not atypical, especially these days. But very much stayed on that planning, design, construction career path. Well-educated, MBA, architecture, Master of Architecture. We find that there are often the degree on the PDC side is a little more prevalent than on the FM side, and that makes some sense in a way, because a lot of your directors of FM, especially in the past, started in the trades and rose up to management positions, where as planning, design, construction, especially the architectural end of it, is much more of a focused education path. So this person, they bounced around big organizations, small organizations, a little varied. Let's go to number 2. So we'll start off on the left side of the screen, my left. Career path 2. This person was at 1 million square foot plus facility, and they are still there. And again, you can see that career trajectory: BA in architecture, MBA, a designer working. Again, we look at the neon green on the architectural side, and then moves into the hospital system and makes a pretty quick movement. This kind of oblong shape notes that all this experience is at the same hospital. So you come in as a project manager. Now, the director of facilities role was one that this person didn't necessarily want, but it was thrust upon them when they found themselves in the role because the prior person had left. And so there was a little bit of hesitancy there. Ended up taking the director role, and now is the system director of facilities. So this is a very interesting, career path to me, especially, knowing the person. In some ways, it was unexpected and not asked for, and was encouraged to take that director of facilities role full time by peers, because peers saw the job that this person was doing in the role, and they said, "You can do it." And they did it, and they're continuing to do it. And now they find themselves on the FM side. But again, a very, very strong design and construction background into the FM role. And now at a big hospital, you can see there it's 1 million plus. So you never know where you're going to end up. Let's go to career path 3. This person, excuse me, is with a system. This is a person that I think of, again, having the benefit of knowing who the people are, has a really interesting career. And it's a career path or a career trajectory that you can take in planning, design, and construction, of working on big projects. And when I say big projects, transformative projects with organizations. And once the transformative building projects are done, kind of moves on to the next one by design. And that's a nice reputation to have in your quiver, being known that you can complete big, complex projects and you can lead them. And this person has done it at a number of institutions. But again, coming into healthcare, and we see this a lot, when I worked in, when I worked in a hospital system, often you would look to some of the consultants that you worked with and think, what, can they potentially move into our hospital role? So you don't necessarily poach them, but because they have consulted for you, and because they've done good work, and because they are used to working in a hospital, often we see consultants, whether it be from your construction management firms or your architecture firms or whatever the firm happened to be, make some nice transitions into the organization that they consulted for. And this person kind of took that consulting and leaped in, and right now is at a nice system with a nice project. And so we always think, when we're doing recruitments, I try to identify who you think would be good fits. And for, career path number 3, he is definitely a person you think, okay, this is a big project. It's complex. Let's get somebody like that in here. You'll notice again, the degree. Career path number 4 is really a traditional one. That you see on the left side, again, 1 million square foot hospital. But if you were to draw up kind of the farm system for feeding in PDC professionals who can move to the manager level, this would be it. Intern, associate, our private architectural firm, and this is actually the career path that we were kind of just talking about. And then becomes a project manager at a large hospital, and then is a manager. So I guess if you're going to put money on where this person would go next, you might say director level, just based on it. But again, a very traditional path. Number 5, over to the right. This is the, I talked about a little bit earlier how often, or not often, more often than not, your PDC professionals have their degrees because they probably started out in an architectural capacity, went to college for it. Then I said, sometimes you forget folks who work in the trades, and this person on the right is an example of that. And so you don't always need that degree, and had plenty of discussions on that before. But, this person, construction certifications, and then came in as an APM and worked their way up too. And you can see often, on the PDC level, much like the engineer, in Career Ladders 3, we talked a lot about the engineers and how engineers often can go from hospital work to engineering work to pharmaceutical because they're in demand. And you see this person, kind of bounced around health system, third-party services provider, health system, now project management services. And again, we see that a lot in this PDC field because you can go the consulting route, you can go the healthcare route, you can go the OPM route. So there's not necessarily, I guess if we're going to look on the traditional career path, maybe career path number 4 and career path number 2 that we looked at, but within the PDC realm, there is flexibility and bounceability between different employers. And these days, you look, at some of these lengths of stay with organizations, and you're looking, 1 to 3 to 4 years. So it's really interesting. But this person is doing it without a degree, moving into a senior project director role without the degree, but has proved it, in the field that they can do the job. And at the end of the day, that's what you're looking for. So those are our PDC career paths. Oof. We go to red for compliance. So before we start to talk about compliance with career path number 1, I just wanted to note, we talked about, I just mentioned how career lengths are shorter than, career lengths, how employment tenures are shorter than they used to be, 1 to 3, 2 to 4. And I think that's becoming accepted these days. It's just the way it is, as Bruce Hornsby would say. But I also did a show, and it should be up by the time this premieres. And if it's not, it will be shortly after. But I talked to Jen Bender. Jen was a vice president of human resources, non-healthcare. She worked at McKesson, worked at a number of other big firms. And I wanted to talk to her. I wanted to get her perspective as a vice president of HR on employee and employment issues, a little bit different look from a person who wasn't with the hospital system, but who did have extensive experience and knew healthcare and is a consultant now. And one of the things that she was talking about, and I think it goes along with tenures, employee stays, was some of the generational differences that she's seen. And one of the comments she makes in that podcast is relative to the younger generations wanting to, and this was her experience, so it's certainly not anecdotal on her part, it's what she experienced. Younger generations coming to her asking for promotion more quickly after a year or after 2 years, and how that was definitely a generational difference than what we've seen in the past. So look for that particular episode with Jen. It's a really good conversation. But I think, as we look at employee lengths of stays, you have that issue where people do want to be promoted sooner. And as you know, that can't always happen. I mean, many things that my dad told me when I was a kid come true the older you get. No doubt about it. And you only get that with age. But, he would always say, talking about how much you learn and you grow as you get older, whether it's in your role, in your personal life, with your kids, whatever it happens. And that is certainly true. There is no other way to learn sometimes than just experience. You can't fast track it. But I think all these things do play into a little bit of quicker tenure. So let's go to compliance, which is interesting because the compliance field or the compliance discipline has certainly been around for quite a long time now. But I think we're starting to see a little bit more as risk because organizations become more risk averse, and as it becomes more complex, as everything becomes more complex, we're starting to see this compliance role carved out in a number of different ways. And that's why I want to present some of these resumes. I don't know if you saw, we did an episode with Steve Call, Dr. Stephen Call. Steve Call is a great guy. He's been on the network a number of times, but he was the author of IFMA's North American Facility Management benchmarking survey. And that survey found that organizations spend 26% of their facilities management budget on compliance. So I was like, and this is the first time the IFMA benchmarking survey has looked at the percentage of facility budget spent on compliance. I thought that was a pretty big number, 26%. So let's look at some of these career paths. And I think, if you looked at the PDC, the planning, design, construction, that was pretty well defined. Compliance, people come to it in a number of different ways, as we'll see. Now, career path number one is, they rose from a membership group hospital system into a large national director role. And you can see how, nice lengths of stays. So the bright red is compliance. I was thinking fire trucks. I was thinking emergency. And the greens, as they were before, the dark greens are your hospitals, and the neon green is the consultant. But I think the thing to take from this particular career path, is there's a lot of opportunity here. Sometimes you got to be, the one thing, and I guess with Zoom and all, it's not, you can meet in more ways across the country, but this person has been able to relatively stay in their location where they want to be geographically. And so as you look at your career, sometimes, that's a consideration. If you're going to bounce a lot, do you need to move, and do you want to move? This person's been fortunate to be able to make it work without moving. Some of it has been, you do a lot of travel, but a national director role, not too bad. Career path number two on the right side. This is a large hospital system. This person was very, very well known, not the best term, but very visible. Yeah, that's a better term. Very visible during COVID. 4 years ago now, just coming up about 4 years. So I was recording this in early March. So just about 4 years ago that everything shut down, man. But a lot of visibility because this person is at a large hospital, was at a large hospital, and was out there on the front lines. You don't often think of your compliance people getting publicity or getting, no, it wasn't publicity. Person certainly wasn't seeking it. but the opportunity and where the person was. But this person is a professor, a teacher. I didn't even list all of the degrees down here, but certainly well respected and AVP with a large system, and has been out there as a speaker, and also a nice visibility within the compliance role. And all of the people, really, it's the same for anybody in healthcare facilities management, but there's such a dedication and such a passion to patient safety and patient well-being and employee well-being through the compliance realm. As we see more people getting hired into healthcare facilities management without hospital or healthcare experience, the compliance angle is one that can be concerning. Learning and all the regulation. I was talking to somebody last week, and they said they were talking about directors. So the person I was speaking to works for a third-party services provider, goes around the country, and provides interim services on the compliance end, but also on the FM end, and was at a hospital. And the hospital, was at a hospital where they had just hired a director of FM. And the director of FM came from the world of academia. And the director was telling this consultant how overwhelming it was to learn it, and how it was just so different than what they had experienced in academics. And that is certainly a concern, to organizations that are hiring folks who don't have hospital experience. Hopefully you have the infrastructure there to support them, because can be a remedy for disaster. These two folks certainly could be mentors to anybody learning compliance. And even within compliance, there's lots of different bucket areas in there too. So there's opportunity. Let's look at number 3. This person, was a police officer. So compliance background, compliance mindset, law enforcement. A lot of times you'll have police officers, and this person didn't retire, but had 20 years in the military before becoming an officer. But officers a lot of times become, upon their retirement, they go to become a safety officer. I was at a Boston College basketball game a couple of weeks ago, and the head of their public safety is the former chief of police in Boston, who was there, very well known. And so these are nice landing places for police officers to work in hospitals. Now, this gentleman here, you can see public safety, but then went to the facility side. Plant ops mechanic, supervisor, manager. And this was all within the same hospital. You can see that little oblong thing that ties them all together. So from public safety, made the jump into FM, but then wanted to return to the safety and compliance. But by that point, at the director level, and that was, it was a small hospital system. And that director of safety and compliance is a role that some organizations do carve out, but a very interesting path for this person, number 3. A lot of, probably not intentionality at the time, but as you look back, and it's always the benefit of hindsight, you can see why that career path made sense, and still doing well as a director at a small hospital system. This is an academic medical center. This person, to me, has a great personality. Not that it matters for you, right? But we talk about skill sets and personality. Not only does he have a great personality, but he's really strong in the compliance route. One of my favorite people who I have interacted with in this role for the last, 11 years. Just a really fine person. And but combines it with the skill set. But we talk about soft skills, and we talk about what you need to be successful. This person's personality enabled, especially in an academic medical center, enabled him to sit at a table and make an impact with folks. And let's be honest, academic medical centers can be tough. A lot of times, there can be paralysis of inaction. They're very collaborative, and this person has the skill set to be able to do that Also had the dual role, right? You look at it, manager of FM and safety officer, director of disaster management. All the time also had his own consulting business on the side, but was at a big medical center, worked well, good education, was a dialysis technician. I used to ask him, what was your plan? What was your plan? And didn't necessarily see making the move out of dialysis, but did. Made a great transition and was really one of the top people that I've ever worked with in that field. Number 5, mid-sized hospital. One of the things that you don't see, but I do. That sounds like nah. One of the things you don't see, but I do, is this person got their degree while they were working in the field. And so sometimes organizations make accommodations for that. Again, we talk about the degree quite a bit. I'm actually giving a presentation at the ASHI Annual in July with Jeff O'Neill from RWJ Barnabas Health in New Jersey, and we're just kind of working on the presentation now. And I just made a couple of notes yesterday about the degree issue, and we've done a lot of episodes on the degree. I don't necessarily feel in all cases it's warranted. Sometimes you'll ask organizations, well, why do you want the degree? They don't even have an answer for that. Well, that's just the way it is. I don't know. I'm not going to revisit it here, but this person, I did want to point them out because they went back and got their degree as they worked. And you can see this path, right? We see the FM side can, we talk about all of these fields that can feed into the FM side. Well, the FM side can also feed into that compliance side. I don't know how that little comma after director got by me. Sorry about that, director. But anyway, this person at a mid-sized hospital and stayed, had a long tenure before moving on to that director opportunity to get back. Sometimes you got to move. Often we'll hear from candidates and they're like, you say, why did you leave that opportunity? And well, because there was a director ahead of me who was not showing any signs of leaving, was not retiring. And so sometimes you got to move to get that director role. And that's what this person did after a pretty good length of stay with their hospital. So that is Career Ladders episode 4 with a look at the PDC world and a look at the compliance world. As I say all the time, the paths to get into this field are varied, and now more than ever, with fewer people out there and with all the retirements, organizations need to be a little flexible with what they're looking at and seeing who might fit for me. Last plug for a show that we did, episode 2 of The Autonomous Employee, the discussion I had with John Crouch. I think probably the last 10 to 12 minutes, he talks about hiring and working with HR and what he looks for. And it was really interesting. It's a different approach. And I think we need different approaches these days to find and hire people. It can't always be a no. It has to be, okay, maybe they don't have everything, but this is what they have. And we see that in some of these career paths that we've looked at. They're not always traditional. And sometimes you might need to make accommodations. And I'm going to jump off my soapbox talking about that. But if you want to talk further about any of this, feel free to reach out. I enjoy doing the career ladders. We'll do a career ladders episode 5. They're fun to look at. And to all you nameless and faceless resumes who we've looked at today, thank you for trusting us. Have a great day. Peter Martin from the Healthcare Facilities Network. Thanks for watching.